Hi, Bassett caregivers and practitioners. Today we're going to go ahead and continue our conversations with members of our new executive leadership team. Today I'm joined with Jeff Joyner, our Chief Operating Officer for the Healthcare Network, hoping to introduce himself today and tell us a little bit about his role. So Jeff, welcome.
Thanks. I'm really glad to be here today.
So tell us a little bit about yourself, Jeff.
Well, I really, much like Lisa, my story is very similar in terms of being in healthcare for many, many years. In fact, I started out when I was 13 working at Maine Medical Center, a 600-bed facility in Portland, Maine, and started out as a junior volunteer, or as back then they would call it, a candy striper. That was probably one of my best experiences in healthcare because looking back throughout my career, that really started my passion for healthcare and being in the industry. I was very fortunate to be working with an individual by the name of George Parody, who was a retired school teacher. And we spent our mornings when I was working at the information desk. I was helping him out. And one of the things that he taught me that to this day still resonates with me is that, Jeff, he goes, look at the people that are coming in this door. Some of them are going to have the best days of their lives. Some of them are going to have the worst. And we're going to deal with all that range of emotion. And that really, as I thought back about that throughout the years, it really instilled in me, what we do here in this industry. We are here to take care of others. And the emotions that we have to deal with, it's extremely rewarding. And so that really started my lifelong passion for healthcare. And in the afternoons when I was volunteering, I was fortunate to work in what we call materials management, or nowadays they call it supply chain management. And that allowed me the opportunity to roam throughout the hospital delivering supplies. So I really got to see the inner workings of a hospital. And from there, I kept doing that for a few years, and that really kind of instilled in me the desire to be in the healthcare industry. From there, went to college up at the University of Maine at Farmington, small little college town, and really it kind of reminds me of Oneonta. Where it's very similar to that area. And from there, getting out of college, like most kids getting out of college, didn't know what I really wanted to do yet, but I knew that I wanted to serve others and I wanted to give back. And so I really thought, why don't I get into politics? And ran for the Maine State House of Representatives, spent 2 terms in the Maine House. And it really gave me a lot of insight into the inner workings of government and how they interrelate the relationship between healthcare and government. From there, I was too young to run for higher office. And so why not, pack my bags, leave Maine, get out, explore a little bit. And I left and went to Washington, D.C. and got my first management job in a hospital down there, which was MedStar, Washington Hospital Center. I spent several years there and went from there to Sibling Memorial Hospital. And then from there, I went to Holy Cross Hospital. So I had a range of facilities that I worked down there for about 15 years. While I was at Sibley, I was fortunate to get an opportunity to go and work at a 1,000-bed hospital system up in Paterson, New Jersey, just outside of New York City. Went up there, took that experience as a COO for that system, and it was a wonderful opportunity. And from there, really wasn't looking to do anything, and I had a recruiter call me up about this position up in Oneonta, New York. And he said, Jeff, you've got to go and take a look at it. First off, I didn't know where Oneonta was or how to really how to pronounce it. It took me a week. But it was a great experience to go through that process, and it was actually 5 years ago this month that I actually came up here for the first time to interview. And as you can imagine, as we look outdoors right now, the leaves were in full bloom, things were beautiful. And when I came up here, I fell in love with the area. I fell in love with the community. I fell in love with Fox Hospital and our system. And so, here I am 5 years later, and I am very fortunate to be part of this organization.
That's a great story, Jeff. I think your earlier comments about sort of what motivated you to go into healthcare and the passion that you described really is inspirational. And I'm sure that it resonates with a lot of our people across the system. So thanks for sharing that. This is a huge role, as you know. I'm really excited about you coming into the Chief Operating Officer role. You're going to have a wide scope of responsibilities, right? You're going to be responsible for our hospital services, our support services across the organization. You're going to be helping us implement a leadership operating system that creates consistency across the network, requiring really a big focus on improving patient experience and access and quality. How do you feel about that? What motivates you? What excites you? What are you looking forward to in this role?
I think one of my strongest skill sets is that I'm a builder. I can bring the people around an issue. We can talk about that issue, discuss our opportunities, and really create that environment for others to come in and be part of that and participate, as well as for them to take ownership in that process. I'm really a true believer, and one of the things I've tried to instill here at Fox Hospital, that it really takes a team to be successful, and that we are going to work together on an issue. And this is something that we will provide transparency through the process, because we want to see what we're not seeing. We want others to be involved and to ask that question. And so I think my role in stepping into this as a network leader is going to be able to bring us together around issues. We know what our opportunities are, and we have a lot of great opportunities. The other great thing that we have in our system or our network is that we have a lot of great resources. So my job is to bring those resources together, get us to working on one focus and be able to be successful.
Yeah, in terms of focus, one of the early priorities and early focal points for you will be, implementing our operating model, which we've been describing over the past several weeks. How do you feel about that?
I feel really good about it, because I think we got a lot of great opportunities to streamline a lot of our services and systems throughout the network, and really starting to bridge opportunities. And I'll give you a good example. When Fox Hospital, our vice president of human resources left, we didn't just go out and hire a new VP. I reached out to Eric Stein. I said, "Is there an opportunity for us to work together?" And Eric said, "Yes, let's come together. Christine could help out and provide services there." And so by her working with us, we were able to start to bring a lot of synergies around our policies, around our services and our benefits. So those are the things that we got to look for, those opportunities in our network.
Yeah, that's fantastic, Jeff. I know a lot of people are excited about you coming into this role. I certainly am. I know the folks at Fox are, and we're looking forward to the great things that you're going to do. Why don't you tell us something fun and exciting about yourself?
That's a good one. I guess one of the things, a passion a lot of people don't realize, is that growing up as a kid, I wanted to be an archaeologist. Some wanted to be, an astronaut, policeman, fireman. I wanted to be an archaeologist. I don't know if it was because I grew up in the era of Indiana Jones, but it was one of those things where I had a passion. And to this day, I still love to go and explore. And I go with my girls, and when I'm down there by the Susquehanna River and we're exploring, and I see my 10-year-old using the metal detector that my grandmother gave me when I was 10, it just really hits home. And those are the things that are fun or special to me.
That's really cool, Jeff. Thanks for sharing that. And thanks for spending time with us today. We look forward to working with you at the executive leadership team level, and I'm sure many folks across the organization are excited to work with you as well. So any final thoughts you'd like to leave us with?
Just that I'm very excited about this role. I'm very happy to be part of this network, and I look forward to all the great things that we're going to accomplish.
Awesome. Well, thanks, Jeff. Thanks for your time today. Take care.